Hello everyone, welcome to Alacrity Explains Anatomy. In this video we are going to be looking at Introduction to Human Anatomy Part 1. So what's anatomy? Anatomy is a branch of medical science concerned with the study of structure of the human body and the relationship between body parts. The study of the structure of the human body and the relationship between body parts. So it is one of the most fundamental and important subjects in medicine. It's very important for understanding physiology, pathology, surgery, radiology, and clinical practice in general. So, what are the subdivisions of anatomy? Anatomy is subdivided into several parts. We have gross anatomy, which involves the study of body structures visible to the naked eye. You can see those structures with your naked eye. Then we have microscopic anatomy. Here, it involves the study of structures requiring a microscope. You need a microscope to aid you to see, and it's divided into two. Microscopic anatomy is divided into two. We have histology, the study of tissues. We have cytology, the study of cells, study individual cells. We have developmental anatomy. Developmental anatomy here, it is the study of the structural changes from fertilization to adulthood. It is different from embryology. Embryology is the study of prenatal development. Every developmental change that occurs while one is in the mother's womb or the uterus. So you have different regions. You have in regional anatomy, places like thoracic region. You have abdominal region. You have the pelvic and pelvis and perineum, the pelvic cavity. So regions. In embryology, you are studying development. You're studying development in utero. While histology is a study of what? Microscopic structures. You're looking at the microscopic level of tissues. Now we have regional anatomy. Regional anatomy is the study of the body in regions. Thorax, abdomen, pelvis, like we said earlier. That's regional anatomy. For systemic anatomy, you are studying the body systems. For example, you study the nervous system. Here you're going to study the brain, you study the spinal cord, you study the cardiovascular system. Here you study the blood vessels, you study the heart. We have surface anatomy. And for surface anatomy, we are studying the external features that are related to internal structures. What did I say? External features that are related to internal structures. We have radiological anatomy. This involves the study of anatomy using imaging methods like X-ray, CT scan, MRI, and likes. And we have clinical anatomy, also called applied anatomy. Here you are learning the application of anatomy to diagnosis and what? Treatment. You are applying the knowledge of anatomy in diagnosis and treatment. So why is the study of anatomy important? Why do we study anatomy? It is the basis for surgery as well as physical examination, because while doing physical examination you check body parts, body regions, so that you know which organ is affected and the likes. Same thing with surgery. So it helps interpret radiological images. It's essential in understanding what disease spread. It is necessary for safe injections as well as procedures, and is the foundation of all clinical practice. That is why we study anatomy. That's the importance of anatomy. Now let's look at anatomical position. The anatomical position is the standard reference position used universally to describe body structures. A standard reference position is used universally to describe what? Body structures. Now look at this. This is what we refer to as anatomical position. Yes. So in the anatomical position, the person is standing erect, facing forward. The head level, the eyes are looking what? Forward. The upper limbs are by the sides with the palms facing what? Forward. Look at this. The upper limbs are by the sides. These are the upper limbs with the palms what? Facing forward. We have the lower limbs together or slightly apart. Look at them. They are together or slightly apart. And the feet are flat and they are directed what? Forwards. The feet are directed forward. This is the anatomical position. This is the anatomical position. It's very, very important. What are anatomical terms of position and direction? Now, there are terms that are used in anatomy. When talking about structures in the body, there are certain terms that are used to describe position as well as describe direction, so that you'll be able to communicate within anatomists as well as doctors. So we have superior, which is the towards the head or upper part. When you talk about superior or cranial, it means towards the upper part. Your head is superior to your neck. It's at the upper part of your neck. Your thorax is superior to your what? To the abdomen. That is superior. You have something. This is superior to the upper part. That's what we refer to as superior. Then you have inferior or caudal, which is towards the feet or the lower part. It is towards your feet or the lower part. Your stomach is inferior to the heart. Stomach is inferior to the heart. We have anterior, which is towards the front. The sternum is anterior to the heart. The sternum is more anteriorly placed in relation to the heart. We have posterior. This means towards the back. And an example is the vertebral column. The vertebral column is posterior to the sternum, while the sternum is anterior to the heart. The vertebral column is posterior to the sternum. So we have inferior going down, we have anterior, we have posterior to the back, and the likes. Now we have median. Now median is exactly in the midline. Exactly in the midline. When something is exactly in the midline, like the nose, we said that that structure is in the median plane. Now we have medial. Now don't confuse medial with median. Medial is nearer to the midline. It's not at the midline, but it's nearer to the midline. For example, the little finger is medial to the thumb. If you stand in anatomical position, look at this position now. If you stand in anatomical position, that the thumbs are more farther away compared to the little finger. So the little finger is closer to the midline than the thumb. So you see that the little finger is medial to the thumb. Yes. So we have lateral. Lateral is farther away from the midline. Yes, we have lateral. This is lateral. You are going away from the midline. This is your midline. Lateral, you are going away from the midline. Medial, you are going towards the midline. So lateral, farther from the midline. Medial, nearer to the midline. So the lungs are lateral to the heart. Now we have intermediate. There are some structures that are found in between the medial and the lateral structures. You have a structure on the lateral side, you have a structure on the medial side, and there are some structures that are in the middle. It depends on the reference you're making. So the clavicle lies intermediate between the what? The sternum and the shoulder. If you look at the shoulder, you look at the sternum, you see that the clavicle lies in the middle. So you say it's intermediate. We have proximal. Proximal is nearer to the trunk or the point of origin, while distal is farther from the trunk or origin. For example, the fingers are distal to the elbow, or for proximal, you can say the elbow is proximal to the wrist. Now look at this image. This is proximal, this is distal. This is proximal, this is distal, depending on what part of the body you're talking about. So now let's move further to talk about superficial, which is near the surface. When they say structure is superficial, it is more closer to the skin. Skin is superficial to muscle. While we say deep, when they say deep, deep is farther from the surface. Farther from the surface. Bones are deep to the muscles. You meet your muscles from outside to inside. You have your muscles first before you come in contact with the bones. So the bones are deep to the muscles. We have internal. Internal means inside a cavity or organ. That particular structure is found inside a cavity or an organ. For example, the internal carotid artery. We have external, which is outside or away from a cavity. For example, the external ear. So you see this. If you look at this image here, towards the surface is what? Superficial. Away from the surface, when you're moving inside, you have what? You have your deep. Now, ipsilateral. Ipsilateral, this ipsilateral, contralateral, bilateral, unilateral, they are regarded as terms of laterality. They are regarded as terms of laterality. Now you have ipsilateral, which means those structures are on the same side of the body. The right arm and the right leg, they're on the same side, using the the median plane as your reference, let's say you're taking the median plane as your reference, the right ear and the right hand are on the same side, so they are ipsilateral. That's on the same side of the body. We have contralateral when you talk about opposite sides. The right hand and the left foot are contralateral. They are on opposite sides of the body. We have bilateral. That means structures are present on both sides of the body. For example, the kidneys are bilateral organs. The kidneys are bilateral organs. The lungs are bilateral organs. The testes are bilateral. So we have unilateral, which means it is present on one side of the body. The right eye injury. When there's an injury to the right eye, you can say the injury to the right eye is unilateral. You have other organs too that are unilateral, like the spleen, the kidneys. These are unilateral organs. Now, there are terms that are specific to the hands and feet. And on the hands, we have palmar, which is an anterior surface of the hand, which is the palm. We have the dorsum of the hand, which is the posterior surface of the hand. Palmar surface is the palmar aspect of the hand. Dorsum is the posterior aspect of the hand. If you look at this, this is the palmar surface of the hand, and the part behind is the dorsal surface of the hand, or the dorsum of the hand. We now have for the foot, we have the plantar surface, which makes up the sole of the foot, while the dorsum of the foot is the upper surface of the foot. Look at this. This is the plantar surface we have here, and at the part facing upwards we have the dorsum of the foot. So thank you for watching. Subscribe to Alacrity Explains Anatomy so that whenever we drop a video, you'll be notified. Thank you.